Phlebotomy Quiz and Test Review. Quiz 1. The Needle Stick Safety and Prevention Act requires employers to involve blood collectors in the selection of safety devices. 2. The recommended disinfectant for blood and body fluid contamination is sodium hypochlorite. 3. An infection contracted by a patient while in the hospital is termed healthcare-associated infection. 4. Pre-examination variables occur before testing of a specimen. 6. Quality management is a process that guarantees accurate test results, timely delivery of specimens to the lab, and quality patient care. 7. Post-exposure prophylaxis, or PEP, should be initiated within 24 hours for maximum benefit. 8. For purposes of accreditation, clinical laboratories may be inspected by the College of American Pathologists, or CAP. 9. Under the Health Insurance Portability and Accountability Act, or HIPAA, written consent by the patient is required to report test results to the healthcare providers. 10. An agency that assures quality care by hospitals is the Joint Commission, or the TJC. 11. Transmission-based precautions isolation categories are airborne, droplet, and contact. 12. 56% of laboratory error occurs in the pre-examine phase of testing. 13. The agency that provides proficiency testing for the lab is the College of American Pathologists, or CAP. 14. The source, host, and mode of transmission are all required to complete the chain of infection. 15. An N95 is a NIOSH-approved respirator. 16. Chain of custody refers to the documentation of handling for legal specimens. 17. Expressed consent is required primarily for invasive procedures. 18. When operating the centrifuge, you must firmly secure the lid before operating. Make sure it is balanced and don't walk away without checking for excessive vibration. 19. Masks are worn to protect against inhalation of droplets containing microorganisms from infectious patients. 20. The Health Insurance Portability and Accountability Act, or HIPAA, primarily affects blood collectors when they are reporting test results to healthcare providers. 21. The program established by a healthcare organization to guarantee quality patient care is quality management. 22. Implied consent is most common in blood collection. 23. Standard precautions include changing gloves between patients, wearing PPE, and observing isolation practices. 24. A patient with tuberculosis would be placed in airborne isolation. Quiz 2. 1. Specimens collected in serum separator tubes are most frequently delivered to chemistry. 2. In an evacuated tube, blood flow into the tube depends on the vacuum in the tube. 3. Gold tubes contain a separation gel. 4. Most anticoagulants in blood collection tubes prevent clotting by binding calcium. 5. The difference between plasma and serum is that plasma contains fibrinogen. 6. Light blue tubes must always be filled to the correct ratio of 9:1. 7. Yellow stoppered tubes containing SPS are used for blood cultures. 8. The anticoagulant present in a light blue stopper tube is sodium citrate. 9. The color coding of evacuated tubes provides all of the following information: presence of an anticoagulant, need to invert the tube, type of specimen collected. 10. A winged blood collection set would be primarily used to collect blood from the hand. 11. The most economical and safest method for performing routine venipuncture is the use of evacuated tube system, or ETS. 12. The most common specimen analyzed in the hematology section is whole blood. 13. The purpose of sodium fluoride in gray stopper tubes is to preserve glucose. 14. To prevent blood from clotting, the specimen must be collected in a tube containing an anticoagulant. 15. A properly tied tourniquet permits arterial flow and blocks venous flow. 16. Pathways of the coagulation cascade are intrinsic and extrinsic. 17. The purpose of gel in an evacuated tube is to prevent cellular contamination of serum or plasma. 18. The primary antiseptic for routine venipuncture is isopropyl alcohol. 19. The ratio of blood to anticoagulant in a light blue stopper tube is 9:1. 20. The tube of choice for trace metal analysis is royal blue. Exam 1. Question 1. The correct order of draw for these tubes would be first blood culture, then blue top, then red top, then green top, then purple top, and then gray top. 2. The median basilic vein is in the crook of the arm. The basilic vein is in the forearm, and the cephalic is in the bicep. 3. The tip of a needle should be visually checked for damage because a blunt or bent tip can be harmful to the vein and may lead to collection failure. Question 4. During the venipuncture, the needle should be inserted at what angle to the skin? Less than 30 degrees. 5. The maximum amount of time that a tourniquet can be applied without jeopardizing the quality of the blood specimen is 1 minute. 6. 70% isopropyl alcohol should be used for skin decontamination prior to a routine venipuncture. 7. A blood specimen is allowed to clot, and the result is serum plus blood cells. 8. Leaving the tourniquet on a patient's arm for an extended length of time before drawing blood may cause hemoconcentration. 9. Match the additive in the collection tube with the color of the tube collected. Light blue has citrate additive. Gray has oxalate or fluoride additive. Green has heparin additive. Lavender has EDTA additive. Red has no additive. 10. Match the additive with its mechanism by which it inhibits coagulation. Citrate binds or chelates calcium. EDTA binds or chelates calcium. Heparin inhibits thrombin and thrombopoietin. Fluoride inhibits glycolysis. Oxalate precipitates calcium. 11. Match the color of the tube to the area of the lab it is most likely to be sent for testing. Purple or lavender tubes go to hematology. Pink or red tubes go to blood bank. Light blue tubes go to coag. Blood culture bottles or yellow tubes go to microbiology. Green or red tops go to chemistry. Red tops go to serology. 12. When decontaminating the site for a venipuncture, the site should be cleaned in a concentric circular motion. 13. When filling a light blue tube, the tube should be filled to the fill line to allow for proper ratio of blood to anticoagulant. The ratio is 1:9. 15. A 21 gauge needle is used to collect venipunctures. 16. A 23 gauge needle is the smallest bore or lumen. 17. The cephalic, median basilic, and basilic are the veins most commonly used for venipuncture collection. Exam 2 Review. 1. When a blood specimen is spun down and the non-red cell portion does not include fibrin, this portion is referred to as serum. 3. Strategies to improve the chances of a successful venipuncture are warming the site and slight rotation of the patient's arm to a different position. 4. A hematoma is swelling at the venipuncture site due to leakage of blood into the tissue. Hemolysis is serum plasma tinged pink due to lysed red blood cells. Hemoconcentration is a condition in which the plasma portion of blood filters into the tissues, causing an increase in non-filterable blood components. Lipemia is serum or plasma with increased lipids present, making the specimen cloudy. Edema is excessive fluid accumulation in the body tissues. Syncope is fainting. Sclerosed veins feel hard or cord-like when palpated. The supine position is laying down. Icteria is serum or plasma that has a gold or green hue due to increased bilirubin. The bevel is the slant at the tip of the needle. 5. A vein might collapse when it is too small and the specimen is being collected too quickly. 6. A red top tube will produce a clot and yellow substance that is called serum. 7. A phlebotomist might collect a throwaway tube when a patient has heavy edema or when collecting a coagulation test with a butterfly. 8. The factors that can increase chances of hemolysis during blood collection are pulling back with too much force on the plunger of a syringe, or vigorously shaking the specimen, or collecting with too small of a bore. 9. It is acceptable to stick a patient twice. 10. Heparin inactivates thrombin. 11. A mastectomy or an IV below the collection site should stop a phlebotomist from collecting blood from a patient's arm vein. 12. A BMP or basic metabolic profile requires a green or red tube. A CBC requires a purple or lavender tube. A type and screen requires a pink or red tube. A PT or PTT requires a light blue tube. Exam 2. Question 1. Leaving the tourniquet on the arm for extended time results in a condition in which the plasma portion of blood filters into the tissues, causing an increase in non-filterable blood components such as red blood cells, enzymes, iron, and calcium. This condition is called hemoconcentration. Question 2. As a general rule, you should not stick a patient more than twice in an attempt to obtain blood. Question 3. The slant at the tip of a needle, which is placed upward when entering the vein, is called the bevel. Question 6. The anticoagulant heparin prevents blood from clotting by inactivating thrombin. 7. There are no additives in a red top tube, therefore the sample yields a clot and serum. 8. A CBC, APTT, and chemistry profile are requested on a patient. The colored tubes that should be collected are lavender, light blue, and green. 9. Veins that feel hard and cord-like when palpated are called sclerosed veins. 10. Syncope is another term for fainting. 11. When hemoglobin is released and serum becomes tinged with pink or red, this condition is referred to as hemolysis. 12. When a patient has difficult veins, some strategies that can be used to improve the likelihood of a successful puncture are the slight rotation of the patient's arm to a different position, warming the site, palpating the entire antecubital area to trace vein path. 13. When performing a venipuncture on patients with edema, the phlebotomist should consider the first specimen tube may be contaminated with fluid. 14. If blood is drawn too quickly from a small vein, the vein will have a tendency to collapse. 15. Swelling at the venipuncture site due to leakage of blood into the tissue is called a hematoma. 16. During the blood collection process, vigorously shaking the specimen tube can cause hemolysis. 17. A mastectomy should stop the phlebotomist from collecting blood from a patient's arm vein. 18. Supine refers to lying down. Exam 3 Review. 1. What color tube should be used to collect the matching test? A yellow SPS tube is used to collect a fungal blood culture. A green top amber tube is used to collect bilirubin. A light blue tube is used to collect a PT test. A gray sodium fluoride tube is used to collect glucose. A royal blue tube is used for trace elements or heavy metals tests. A gray tube is used for lactic acid. 2. The timing for an oral glucose tolerance test, or OGTT, begins when a patient finishes drinking the glucose. 3. When properly labeling a specimen, the date of birth, date and time of collection, collector's information, patient name, and medical record number should be on the patient specimen. 4. 2 blood culture sets from a patient requiring stat administration of antibiotics are collected immediately from 2 different sites. 5. When collecting specimens for legal blood alcohol levels, cleanse the site with a non-alcoholic antiseptic solution, benzalkonium chloride, or soap and water. 6. Heparin inhibits thrombin. 7. Prolonged fasting could cause decreased glucose. Long-term exercise could cause increased creatine kinase. Stress could cause increased white blood cells. Altitude could cause increased hemoglobin. 8. Thrombi is a clot formed on the inner wall of a vein. Peak level is the specimen collected when a serum drug level is highest. The trough level is a specimen that's collected when a serum drug level is lowest. Plasma is the liquid portion of blood with fibrin. Septicemia is the presence of pathogenic microorganisms in the blood. Serum is the liquid portion of blood lacking fibrin. 9. After collection of a specimen, it should be transported to the lab in a biohazard bag. 10. Fluoride inhibits glycolysis. 11. Citrate and EDTA chelate calcium. 12. Bilirubin should be protected from light. Blood gases should be transported on ice. Ammonia should be transported on ice. And vitamin B12 should be protected from light.